Assalamu alaikum. I'm Dr. Amber Khan, and I'm the chair of the IMANA Education Committee. Firstly, I would thank you all for listening to the recording today. We have an array of webinars that we have scheduled for this summer that we hope that you will stay tuned in on. For this morning, we have a talk given by Dr. Quratulain Syed. She is a board-certified internist and geriatrician. Her clinical practice is based at GenCare Senior Medical Center in Atlanta, Georgia. Her clinical expertise and interests include driving safety, cognitive impairment, elder abuse and neglect, polypharmacy and deprescribing, transitions of care, and improving outcomes post-hospital discharge. She serves as a member of the Disparities Task Force at the Society of the General Internal Medicine, and she's at the Public Education Committee at the American Geriatric Society. She also serves on the Driver's License Advisory Board for the Georgia Department of Driver Services. This morning, Dr. Syed will be speaking on advanced care planning. This is a topic that is generally neglected in majority Muslim communities and something that is much needed to discuss, especially in today's time. So on behalf of IMANA Education, we would like to thank you, Dr. Syed, for taking the time to talk with us and to share your expertise. Please begin whenever you are ready. Jazakallah khair.
Assalamu alaikum. I'm very thankful to IMANA to invite me to talk on this crucial topic. I have tried to tailor my presentation to both healthcare professionals and general public, and I look forward to answering any questions. At this talk, we'll try to cover reasons why we should complete advanced directives, how to follow a structured framework when completing advanced directives, and where to find appropriate resources for completing advanced directives. So I'll go over terminology a little bit. So advanced directives is a broad term that is used to define legal documents that can be completed by a person and guide their medical team and families as to what to do in case of a medical emergency. So advanced directives include two documents. There is a living will and there is a healthcare proxy. A living will is a legal document that where a person can put in their wishes about medical care in case of a medical emergency or at the end of life, which guide family members and clinicians as to what to do in case of those situations. Also, there is a document, healthcare proxy, where a person can designate somebody to speak on their behalf in case of a medical emergency or at the end of life when they may not be able to speak for themselves. Other than advanced directives, there are these medical orders, which are in different states. Most states have a do not resuscitate order where people can sign this. The medical orders do require consultation with a clinician where a clinician has to actually sign them. So a do not resuscitate order where a clinician signs it for a person can take effect right away. Also, in most states, there is a physician order for life-sustaining treatment, which again, a person gets to complete with their clinician. The clinician signs on them, and that is a more detailed document where, in addition to resuscitation options, there are options about whether a person would like to be on ventilator, whether a person would like feeding tubes, whether a person would like to be in the ICU in case of an emergency, dialysis options, and other detailed treatment options. So when we are discussing advanced directives and thinking about advanced directives, there are a few procedures that are relevant. Many of these procedures, the success of these procedures does depend on a person's comorbid medical conditions. So when thinking about advanced directives and completing advanced directives, it's good to talk to your clinician to see which of these would be appropriate for a person and whether a person would benefit or not benefit from these. So we'll start with cardiopulmonary resuscitation or CPR. Many people are familiar with CPR because people take classes for them at work or in school. Also on media and on television shows, CPR is actually fairly commonly seen where There's also more dramatization of CPR. People see on television shows that a person has CPR and then walks out of the hospital. So CPR is a very valuable tool that is supposed to get buy a person time in case of a sudden cardiac arrest till the emergency medical professional actually get there and then get the person critical help and then take the person to the hospital for further critical care. However, CPR is not meant to reverse the process of death. It's not meant to reverse the process of multi-organ failure or an advanced cancer. So in those situations, a CPR may not necessarily be very beneficial. It may cause more harm and more discomfort. The second is intubation and mechanical ventilation. So if a person stops breathing, a tube is put in their chest, the person is connected to a mechanical ventilator, and that breathes for this person. Most people heard about ventilation also in the era of COVID-19, where people heard about shortages of mechanical ventilators. So again, based on what a person's comorbid medical conditions are, while the ventilator can support the breathing, and the physicians and the clinicians can treat their underlying problems based on their comorbid conditions, this may or may not actually help in the long run. The third is feeding tubes. If a person can't eat by mouth, a feeding tube can be inserted through the skin directly into the stomach or in the intestines, or it can be put through the nose into the stomach to feed a person. If a person had a recent stroke or has a cancer where the prognosis is good, then a temporary feeding tube till the person is able to eat by themselves while getting the treatments is useful. In patients who may have advanced dementias or advanced cancers who may not be able to eat, these may also have some harms as to causing pressure ulcers or other problems. The next is ICU stay. So if a person gets sick, a person can get to stay in the ICU, get aggressive treatments based on what a person's age, comorbid medical conditions are. These aggressive treatments may or may not be helpful. Like some people who may have advanced dementia may get much more confused in an ICU, which may have much more difficult consequences. The next, hemodialysis. So if kidneys fail, then a person can get dialysis to support the kidneys. If it's somebody who has who is in the age group where the person can get kidney transplant eventually, then the prognosis is different. Otherwise, based on what a person's other medical problems are, it may or may not improve a person's quality of life. At the end of life, a person does have the option of, after death, getting an autopsy to see what caused the death and to be able to donate organs to someone who is in need. So those can also be mentioned in a person's advanced directives. So I'm going to talk a little bit about Islamic perspective on advanced care planning. So I would also mention that I'm not a religious scholar. So if you have any complicated questions on Islamic perspective, I would defer them to the religious scholars. So there is this, I would quote this Quranic ayah: if one of you facing death can leave a legacy, he should bequeath it to his parents and relatives according to the law. This is the duty of the pious. So while this is an ayat about financial will, not healthcare will, it does clearly indicate that Islam encourages believers to think about that and to actually plan about that. The next is a hadith by the Prophet Muhammad sallallahu alaihi wasallam. It is not permissible for any Muslim who has something to will to stay for 2 nights without having his last will and testament written and kept ready with him. Again, this is about financial will, but it still highlights that Islam encourages Muslims to think about that, to plan about that, and actually to keep things in writing in anticipation of that. Now I'm going to share about Islamic perspective on patients' autonomy at the end of life. So there is This incident quoted from Sahih Bukhari, where the Prophet Muhammad sallallahu alaihi wasallam in his terminal illness asked not to be given medications in view that his death was imminent and that the treatment was futile. But in one of the episodes when he became severely unconscious, he became temporarily really unconscious in his final illness, his companions, out of love for the Prophet, tried to force feed him. When the Prophet regained consciousness, he was not happy about it and reprimanded them for doing so. So this does highlight that Islam wants surrogate decision makers to actually respect the wishes of the people they're making these, they're caring for at the end of their lives. On Islamic perspective regarding resuscitation at end of life, I'm going to share a fatwa that was issued by the Permanent Committee for Islamic Research and issuing fatwas in Saudi Arabia in 1989. So so it says that there is no need to use resuscitative measures in any of the conditions below, as long as there is agreement of or authentication by 3 competent physicians. So number 1, if a person arrives to the hospital and is already dead, a person should not be resuscitated. If the medical file of the patient is stamped "Do not resuscitate" according to the person's wishes or those of the proxy, and the person is unsuitable for resuscitation as determined by 3 competent clinicians, a person should not be resuscitated. If it's inappropriate to resuscitate a person who's suffering first from severe medical conditions and death is almost certain, a person should not be resuscitated. If a person is physically or mentally incapacitated, suffering from severe cardiopulmonary disease or stroke or advanced cancers, or has had several cardiac arrests, a person should not be resuscitated. If the person has had extensive brain damage after cardiac arrest, should not be resuscitated. And then if 3 competent physicians feel that the resuscitative measures are useless or inappropriate, then a person should not be resuscitated, even if their prior wishes indicate so, or if the families want the person to be resuscitated. And in that case, the families should be informed about the fatwa. Next, I'm going to talk about the difference between physicians' orders and the advanced directive living will. So as we discussed a little earlier, a living will is a legal document where a person gets to write about their wishes, and physician orders for life-sustaining treatment is actually is a medical order where a person sits with their clinician and actually fills them. So anybody over 18 can fill a living will, and ideally everybody over 18 should fill a living will. However, physician order for life-sustaining treatment is mostly for people who are seriously sick, who have advanced illnesses. They can go to their clinicians and complete one. A living will gives general instructions for a future treatment. So if a living will has certain things written in it, a person collapses, has a cardiac arrest, 911 gets there, they will do whatever they need to do in that situation, and take the person to the hospital. And then the person gets to the hospital, the clinician in the ER will probably read the advanced directives and then see if they actually apply to that situation and then follow them. However, a physician order for life-sustaining treatment is a medical order for current treatment. So if a person passes out, there is a cardiac arrest and it says "Do not resuscitate" there, 911 does take those orders and would not resuscitate the person. So how to complete these documents? All adults over the age of 18 should complete an advanced directive. People should also periodically update their advanced directives in case of a change in their values or preferences or their health conditions. And then if a person gets diagnosed with an advanced illness or has more frailty, then they should go sit with their clinician and complete a POLST form. This is the physician order for life-sustaining treatment. And then they should update them off and on in case there is a change in their health status so that their wishes are up to date. Now I'm going to talk a little bit about a framework for discussions that physicians and clinicians can use when discussing advanced directives with their patients. This has been taken from the book Being Mortal, and Dr. Susan Block is quoted with this framework. It's a great book to read for everybody. So if you haven't read this book, please feel free to check it out. So when talking to your patients about advanced directives, the first thing, what is somebody's understanding of their illness? What is their understanding of what the illness is? How severe the illness is? Then what are their fears or worries for the future? Some people have fears that they may be dependent on others. Some people may have fears about pain. Some people may have fears about the process of dying. What are their goals and priorities? For some, seeing a grandkid's wedding before passing away may be important. For some, fixing their financial situation may be important. For somebody else, there may be something else. What outcomes are unacceptable to the person? For someone, being dependent on others for their care may be unacceptable. For others, pain may be unacceptable. What is a person willing to sacrifice and what is a person not willing to sacrifice? What would a good day look like? Would a good day look like if a person is able to walk to their garden and look at their plants, or would a good day look like when a person can sit with their family and have meals? How would they like to spend their time if the health worsens? And then who would a person want to make decisions if they cannot make their own decisions? Next, updating advanced directives. So how often should we all update our advanced directives? We should update our advanced directives if there is change in our health status. So if a person gets diagnosed with a new condition, or the condition worsens, or maybe a medical condition gets cured, like a cancer gets cured and a person is cancer-free. In all those situations, a person may want to update their advanced directives. Also, if there is change in your values and preferences, like I may want a particular treatment in case needed. However, I may end up visiting somebody in the hospital and seeing them go through that treatment. It may change my preferences and my values. Also, if there is change in your social dynamics, if you have listed on your healthcare proxy somebody who either gets diagnosed with a severe illness or passes away, then that person may not be able to make decisions for you in case of a need. So maybe you need to update your advanced directives. Also, if a person has a spouse listed as a healthcare proxy on the advanced directives, and then there is a divorce, and is that person still okay with the ex-spouse making their decisions in case of an emergency? If not, then the person should change their advanced directives and update them. So I've listed a few resources of where you can find advanced directives. So based on which state you live in your state, on your state government's website, there is the advanced directives document. Also, prepareforyourcare.org has the advanced directives for all states. So if you go to prepareforyourcare.org and put in the name of your state, it pulls in the legal advanced directives of your state. It's free to download. It's easy to read in a fairly user-friendly format in at least 10 languages. So a great resource. If you go to agingwithdignity.org, there are the 5 wishes advanced directives. Again, the 5 wishes advanced directives can be tailored to your state. So you put in the name of your state, it pulls in the advanced directives, and then you can download them and complete them. Compared to Prepare for Your Care, which is free, the 5 wishes is not free. I believe it's a $5 cost per advanced directive. And then the American Bar Association Toolkit for Healthcare Advanced Planning does have some good content on it regarding scripts and decision-making tools. It does not have the documents for a person to go through and complete the advanced directives, but it just has like good information for people to read and understand what advanced directives are, and for clinicians on how to have these conversations with their patients. Also, what happens if you don't complete your advanced directive? So if you don't complete your advanced directives, then in the United States, resuscitation is the default. So if a person has a cardiac arrest and there are no advanced directives, then everybody gets resuscitation and gets put on life support as need be. Also, if a person has not completed healthcare proxy, then the decision maker is based on the surrogacy in the state where you live. So in most states, the first one is the court-appointed guardian. If there's no court-appointed guardian, then there's the spouse, and then adult children, and then parents, and in that order. As for billing purposes, in previous years, clinicians felt they did not have time to have these conversations in their offices with their patients. Now Medicare actually pays for it. So Medicare pays for an office-based end-of-life counseling session with patients for 30 minutes at CPT code 99497. And then there is an additional 30 minutes for 99498 code. This can be billed either for a face-to-face clinic visit or for a video telehealth visit. There's no format for conversation, and it does not require you to complete a form during the visit, as long as the conversation is around end-of-life counseling. And this can be billed. This doesn't have to be billed just once in a year. This can be billed a few times. So as long as the clinician is having a conversation with their patients about end-of-life care, this code can be used. So some public education resources. What doctors know about CPR is a document created by palliative care physicians at Duke. It's great and goes over what CPR is utilized for and what CPR is actually meant to do. So in which situations would CPR not be useful? The National POLST website has a lot of good information about what advanced directives are and how to complete them, and what advanced directives are useful for which person. Optimisticare.org has information on end-of-life issues regarding patients living in nursing homes. And then healthinaging.org is a website of American Geriatric Society that has a lot of public education content on it, a lot of great public education content, including on the topic of advanced directives. So I would recommend people to check it out. Now I'm going to end my talk with the references that I have listed here, and I would be happy to take any questions.
Thank you so much, Dr. Syed. It seems definitely from a fiqh perspective that Muslims, we have a very different attitude compared to other faiths about the idea of life and death. And, for the latter, their goal is to extend life no matter what circumstance, no matter what the cost. But, as you discussed, for us, we honor the children of Adam. We are karama. We are, to have a dignified death. And so this is something in which it's a very important thing for us to learn about and to understand from a fiqh perspective, because, this is a very personal thing for ourselves to go through, or our spouses or our parents to understand that, the allowance of having a dignified death, as you talked about, dying with dignity, or, being in a persistent vegetative state, having very little chance of being able to open your eyes or eat or sleep, that that it's permissible to not want to have medical intervention. So it's, it's a very interesting perspective, mashallah. So thank you so much for touching on that. And also the resources that you mentioned for advanced directives, thank you so much for including that. And I would love to include that on the IMANA Education website for anyone who may be interested in wanting to take a look at that. The Prepare for Your Care, as Dr. Syed mentioned, it comes in 10 languages, so that could be very helpful in different communities or free clinics that we can offer, and the 5 wishes, and of course the American Bar Association. I did have a question in regards to the importance about having these types of conversations before we find ourselves in that state, putting it in a will or getting it notarized, or letting our families know. There was a research study that I came across recently, and it found that families who have to make decisions on life-saving decisions they have symptoms like PTSD, that it causes harm. They feel responsible, to quote unquote pull the plug, or that some siblings may fight over a decision, especially in the case of an Islamic perspective on, is this okay or is it not? What experience may you have, or any advice that you can offer in regards to kind of having these conversations ahead of time, or how we should navigate through those conversations with our elderly, or even between our spouses?
So yeah, it's a great question, and something that it resonates with me personally also, because 3-4 years ago, when my father suddenly got diagnosed with an advanced cancer, he was a very functional person who was working at a bank, and gets a CT scan and suddenly gets that, it shows like a cancer that's spread everywhere. And then there was a steep decline over the next 6 months, leading to his death. And during that time, because in his earlier years, he never completed an advanced directive, we never talked about this issue. And then when he suddenly gets diagnosed with this advanced cancer, it was very depressing for me, his daughter, to be having this conversation with him and with his clinicians, because of like suddenly he gets sick, his team changes, his clinicians change. So it was, nobody actually had this conversation. So at the end of life, when he was passing away, I was making basically a guess based on what his values in his life were, of how he wanted to be pain-free, and he hated pain and he hated hospitals. And based on that, I sort of made a decision. But it was like talking about the PTSD, I mean, his last days, and basically that decision-making process, I still think about it, and it's fairly traumatic. So now when I'm talking to my patients, I usually, because I have myself gone through it, so I sort of tell them that if they don't want to put their family members and their caregivers in a state when nobody knows what to do. So it's a good idea when people are able to talk for themselves, that they actually put things in writing. Also, I've had patients where suddenly the person gets terminal, like has a condition where the person decompensates pretty fast, and the family members, if they're having an argument, then they would come to my office saying, do you have a documentation of what the person wanted? And I can search up and pull up my last note where I had that conversation, and I can print it out to them and saying, okay, this is what this person said they would like in case of an emergency. So if it's the person's own words, they take one, legal preference, and then second, for families to know that this is what their loved one wanted, so they need to respect the wishes of the loved one. So completing these advanced directives and having these conversations when people are in their good health is very valuable. So I tell my patients that when these holidays come, like Eid or Christmas, when families get together, as much as these conversations are unpleasant, like talking about death is unpleasant, but these are good conversations to have during those times, because families get together, everybody can hear it. So you can just tell everybody that these are things that you would or would not like in case of an emergency. So that's actually a good thing to do, that when people get together during long weekends or other religious celebrations, to have a small discussion with your family members about this.
Yeah, absolutely. Jazakallah khair. That's a great idea. It's definitely an uncomfortable conversation to have, but it's much better than dealing with, the mental anguish and, the potential family struggles that can result by not dealing with or not preparing for it in the moment. And with everything going on with COVID, I know that this was a very common, discussion amongst, especially within Muslims, of having this, because, in this particular case, there are no visitors allowed, and you're kind of at the mercy of the doctor in that situation, or having to communicate in a way where you cannot be with your family member in that state. And so it kind of allowed for the awareness of the importance of this conversation. And so Jazakallah khair for bringing that up, and also the awareness of the fact that it's okay to say no to medical intervention, and that this is something that is permissible within your state. And if you are not sure, or you mentioned about your father and him not liking hospitals and not wanting to be in pain, and that that there is an element of dignity there. And as you mentioned, the Prophet ﷺ, even on his deathbed, that family members tried to give him medicine, he turned his head away. And so we see that this is not against the Sunnah. This is actually living in the Sunnah. It doesn't mean that if you want medical intervention that you cannot have it, but it allows from this different perspective that we don't touch upon and talk about too much. So thank you so much for allowing us to introduce this type of conversation that we don't feel like we have enough of. Thank you so much for taking your time. I know your expertise is in many topics within geriatrics, and we would love to have you back to inshallah maybe discuss some more further topics in the future. For example, the polypharmacy, anti-prescribing that I know within our community, that's a very common issue and something, again, that we don't talk enough about, which is elder abuse or neglect. For those who are listening, we will post Dr. Syed's information attached to the session if you would like to send any questions or if you would like to request any future webinar topics that you would love for her to touch upon. Any last questions or comments that you would like to share or address, Dr. Syed?
No, thank you so much for inviting me, and I look forward to having further conversations on other topics of interest. Thanks a lot.
Jazakallah khair. Thank you so much. We'll go ahead and end with Surah Al-Asr. A'udhu billahi minash shaitanir rajeem. Bismillahir rahmanir rahim. وَالْعَصْرِ إِنَّ الْإِنسَانَ لَفِي خُسْرٍ إِلَّا الَّذِينَ آمَنُوا وَعَمِلُوا الصَّالِحَاتِ وَتَوَاصَوْا بِالْحَقِّ وَتَوَاصَوْا بِالصَّبْرِ. By time, indeed, man is at a loss, except those who believe, who do righteous good deeds, who recommend one another to the truth, and who guide one another to patience. We will be posting other webinars coming up this summer, and we will keep you informed on our social media, so please stay tuned for some more upcoming webinars that we have this summer. Jazakallah khair. Assalamu alaikum wa rahmatullah.